Hi, I'm Dr. Natalie Cordova with Core Chiropractic, and I would like to explain what spondylolisthesis is and best practices for spondylolisthesis. So if you've been diagnosed with this, let's understand what that is. When you look at the spine, I've got a model of the spine. This is a vertebrae. This is your lumbar vertebra down in the low back. So if you have all of the bones of the spine continuous, then there's going to be the best alignment for your spinal cord. That is very important. You have the body of the vertebrae in front, and you have the joints of the vertebrae in back, and those joints limit how much translation can occur of one bone over the other. So when you've had a spondylolisthesis, whether it's because you've elongated your joints or you've actually broken one of the joints and it's slipped forward, both of those can contribute to having a spondylolisthesis. So sometimes you'll have the diagnosis of a spondylolytic, which means a broken part of the bone. That's the lytic part, spondylolisthesis, or just a spondylolisthesis. The lytic version is obviously going to be more vulnerable because that can slide further and not be as secure and braced behind the other joints. So how do you take care of a back that has a spondylolisthesis? So the best understanding of this is that this has moved forward beyond what is normal for a spine. So having a few millimeters shifting forward is going to compromise both the spinal cord as well as the nerves of the spine. Typically, you're going to see this at L4 or at L5, sometimes a higher up or even in the neck. That's got a common one. But for our purposes, we're going to focus on the low back and how to have the best alignment in your low back. So you want to make sure that you have good alignment. And so that from the front view, that's easy. You want to have good alignment where it's just straight up and down, but from the side, you're supposed to have curves. You want to keep L4 or L5 over the one below it as best as possible to minimize that tension on the spinal cord and the nerve. So my advice would be first seek a chiropractor. So a chiropractor is going to help with the alignment and the position of the spine above and below that spondylo so that it limits how vulnerable it's going to be. And having a balanced pelvis is very helpful to maintain the best position for this. The second would be to lose weight. So any excess belly weight is going to add to having that being pulled forward. And that's what you're trying to avoid, is having that being pulled forward. So get on a diet, make sure that you have as much core strength and limit that weight factor. The third thing is sleeping postures. So how do you sleep well for 6, 7, 8 hours a night with a spondylo? The worst way is going to be on your stomach. So do not sleep on your stomach, allowing the gravity to pull that more forward and to compromise the joints in the back. So the best way is going to be on your back. Most people find that if you're on your back with a little pillow underneath your knees, that's going to be the most comfortable. It takes a little tension off those hip flexors and limits that bone being pulled forward. So flattening the back, laying down on your back is most comfortable and the healthiest. You can go on your side, but it's not going to be as helpful as if you were laying on your back. So I really encourage sleeping on your back. Now, from a standing position, what's going to be a good position? As you're standing and holding up your weight, you want to focus on how your pelvis is positioning in respect to that spine. So having a balanced pelvis, so it's not way tucked under and it's not tilting forward, it's that tilting forward that's going to be the worst for you because it allows that lumbar spine to lean more forward and to tether the spinal cord. So you want to limit that, right? So you don't want it to slide forward. You want to tuck the butt. So that's where you're shifting your pelvis, strengthening and contracting your hamstrings so that they're securely holding your pelvis and your body over your feet and not leaning forward. So you want to limit the tightness that's occurring in hip flexors, keeping that lined up so your body is over your sacrum and your pelvis and distributing it that way. So again, keeping a nice core strength and bringing in the abs, so that's over your body. Once you're in a good position and you're walking around, this is where you're going to have to rely on your exercises to keep you nice and strong, because you're not going to remember to do this. You have to train yourself on a regular basis to continue and maintain this type of posture. So what are good exercises to do for this? So there's some good exercises and there's not good exercises. The first thing I want you to understand is laying on your stomach is going to be bad, because that's going to cause the gravity to pull you into to challenge that spine. So if you're on your stomach or doing exercises on your stomach, those are the ones you want to avoid. So don't do Supermans, don't do Cobra. You want to try to get on your back or being upright in a healthy position. You're going to also want to avoid twisting as well. So having an upright position, steady movements are very healthy, and they're going to keep you out of trouble. And the more that you jar, lean forward or twist, that's going to keep you more likely to be vulnerable and to cause damage to your spine. So with that, I like walking. I think that's great. Keeping your body upright and that belly tucked. You could also do ab exercises where you're not doing a lot of flexion in your spine, but little crunches so that you're strengthening your abs. I don't like doing planks because that's going to cause you to pull your stomach forward. I do like having good strength of your hamstrings, and so if you're doing a deadlift, there's a certain type of the hex deadlifts where you're going to raise up your body and you're not leaning forward at all, but you're strengthening only the hamstrings. And so I would be very, very careful about what type of deadlifts you're doing, so that you're really getting the hamstrings to be stronger, which is very important, but not compromising rounding your back in any way. With that, you're also looking at squats. So if you're doing a front squat, you can brace your belly, keeping your body upright, and you can still squat down and up, holding it there. But if you have a rack on your back, that will cause that leaning, which means you're going to extend, and that extension can pinch, and that can be very uncomfortable. So I would avoid back squats. So front squats are okay, but back squats, not so good. Also doing heavy bench presses too. So you want to be careful of that extension and that pinching of that low back. And that's where doing heavy exercises can cause that to be a problem, as well as overhead stuff. So again, if you're doing overhead and extending your back in any way, that will cause that to be compromised. So you want to be smart about how do you maintain and be healthy for your spine. Those are the things that you're worried about, is pinching, extensions, right? And then the next one would be the twisting part. So tennis, golf, things that you're going from side to side, even swimming, because you're on your stomach, but you're also twisting to be able to breathe. So that I would avoid. Or water aerobics, that would be great, because then you're going to be buoyant, but you're also upright. Love that one. If you're going to be in a Zumba class or a yoga class, just avoid the twisting part or the on your stomach motions, so that you can avoid the compromising. So those are some great best practices so that you can have the healthiest back for a long, long time and staying out of surgery.